Happy Friday, everybody. Dr. Peter Valenzuela, I'm the Chief Medical Officer for MMG, and I want to thank you for taking time to look at our video. Today, I have a special guest, Dr. Christine Braid. Christine's our Medical Director for Virtual Care and Innovations, which I think is a really cool name. And she's actually here to talk to us about a couple of the updates. So, Christine, thanks for being here.
Thank you. Thank you for having me.
And I see you're wearing red for Heart Awareness Month for Women. Is that correct?
Yes, it is Go Red Day on February 4th to make awareness of Women's Heart Month.
And I'm embarrassed to say I actually knew about it, but I don't have anything red at home that was available to wear, so I apologize for that.
I'm wearing enough red for both of us, so it's okay.
So, Christine, I know we have a couple of things going on in the virtual healthcare world, and I know that we've had physicians and clinicians who've reached out to me to say, hey, you know, the patient portal's been cumbersome and our website isn't where we need it to be, and I'm super excited to hear some of the things you want to talk to us about related to those areas and see how things are going. So, why don't we start with the website component? I know you guys have been doing work with that. Can you give us some updates on what's coming and what you see?
Sure. So there are several things that we've been working on. One of the things that I'm probably the most excited about is the dashboard and the database for the physicians. And I'm not sure if everybody's aware, but on our patient-facing website, the way that our data has been collected and updated has been through Health Grades traditionally. And Health Grades collects our data and updated it for the patient-facing. The new way we've been trying to do it is have our dashboard and our database controlled by ourselves. So if there's an update to our credentialing, if there's an update to our location, that we can actually make sure it's correct. And when we think of if I change locations or if I go from one site to another, we want to make sure that that is actually reflected accurately on our website. We just, as of yesterday, got that internal, and it's actually through a program called Simpler. And when we think, why is that important? If we can control that, we can make sure that our operations and our physicians have control of that. So that will work for our marketing, that will work for our patient-facing, but also our internal-facing website. So now this may seem like I'm rolling back time here, but we actually have our own MMG Way website for physicians. Mm-hmm. And one of the things that I was waiting on to roll this out in a really strong was this database for our physicians to make sure that we onboard, and if a physician leaves us, that happens automatically.
Nice.
But it was based on having an accurate database for our physicians. So now that we have that, we'll be able to roll out the MMG website and make sure that we have our internal information for our website and an accurate database. So I'm kind of excited about that. So that's one of the cool innovations.
So you're saying, so now you will not be listed as a psychiatrist in Elpro?
Gosh, I hope not. No, nothing against psychiatry.
Yeah, no,
Very
definitely
awesome
not. I think the key is really having accurate data and accurate locations, which, believe it or not, we haven't been great with that. Yeah. So I know that's really great to hear from the website aspect. What about the portal? Anything going on with the portal that might make things better both for our patients and maybe for our clinics and care center?
Yes, there are actually some updates on the portal that are happening. And so one of them, and Dr. Quadro and Greg Light in the pharmacy team are working on ways that we can improve the portal to have patients request their pharmacy prescriptions through there. And there's actually going to be a very specific team that works with the enhancements in the digital team to work on the engagement. Some of you may have seen some of the server change issues that happened in the summertime, where the portal went down for a while and the patients had a hard time accessing. And then the enhancements, there were lots of opportunities for the portal to get better during that time. Well, there are some new ways that we can now send invites out to the patients, and we're working on some dashboards and metrics on tracking that improvement. Starting in the next week or so, we're going to be having a smaller work group to push these enhancements through.
Okay.
So look forward to those, and we'll be reporting back as those portal enhancements come out.
Great. Now, I've been hearing a lot recently about Notable and how it's going to make things a little bit easier for our staff. Can you talk a little bit about what Notable is and how it's going to play in?
Yeah, Notable is probably one of the most exciting things that's coming out, so I was saving that to the last.
Okay. Did I ruin that? I'm sorry, I didn't know.
No, not at all.
I'm excited about it.
Yeah. So Notable is a patient registration system, but not only that, it includes a lot of the kind of cool features that we probably wished we had for years. So it has a texting notification system for the patient. It has a registration, like an automatic text to phone registration system. It has digital e-consents to the patient that can be texted straight to the patient on their devices, and then it can come back into our system that is integrated into Cerner.
Nice.
What? We have something
Nice.
integrated into Cerner? Shocking. It has, it can actually, as we roll this out, can push things like annual wellness.
So reminders and
Reminders
Okay.
can reach into the system and do some database checks for our patients. It has the forms that can go out to the patients for, some of the features are very advanced, but it can look and say, this patient has diabetes, hypertension, hyperlipidemia, and push specific forms out to the patient that then can come in and help us create the note for the patient in advance.
Nice.
And then put it into Cerner. It does a lot of the check-in process for the MOR and the MA in advance. There's an insurance scan. And so these are features that as we integrate them into our system can be enhanced as it is useful for us. Some of us may be familiar with it. We use this in the vaccine clinics for COVID. And it was just a piece of it. It was QR codes and scanning for the patients to help us with that system. Very exciting.
Yeah.
The first wave comes out in March. So that's actually right around the corner. And then for the specialty clinics and the clinics that currently have Freesia, those will be another wave a few months later. So we want to make sure that the enhancements are successful.
Great. So it starts off in primary care here in the next month or so, and then a few months after that, it'll be in the specialty care center.
Yep.
Wow, that's super exciting. I think it's great to be able to have the patient fully registered and even have the potential to have part of your note done with the forms ahead of time. That'll help the patient, it'll help the front desk staff. It should hopefully help our physicians and clinicians.
Yeah, it's actually a really slick technology. I've been hearing about it for years, and I'm glad we're finally getting something cool. And I love innovations. That's my thing.
Yeah, well, thanks, Christine. I really appreciate the updates. Anything else you want to share with us before we sign off?
Yeah, there's another kind of word combo you'll hear a little bit, and it's Digital 1.0.
Okay.
And so it's a series of things coming out from the IT, and it has 7 products on the list. I mentioned a few of them. And so they have this unified web experience, which includes single sign-on for the patient on the app.
Got it.
It has the provider search and directory. It has this kind of light version of this digital front door. I almost hesitated saying that because it's not quite what we think of digital front door. The ambulatory registration, which we are using a Notable product, but in Common Spirit, who is not getting Notable, they have this kind of light registration scanning,
Got it.
scheduling and those sort of things. So you may hear people talk about Digital 1.0. We'll mention it and kind of keep updated on what's going on and how that affects us at Mercy, and have a team in the innovations that will keep everybody apprised to what's going on as well.
Great. Well, I'll tell you, I'm excited to hear that we are making some progress in the digital front door and virtual world, and really appreciate your leadership at this. Thanks so much for making time for us.
Yeah.
So,
Thanks for having
thanks
me.
everybody. You guys have a great weekend, and once again, be safe out there.
All right, and happy heart.
Bye-bye.